Hi everyone, I'm Dr. Z and you're watching Dr. Z PhD, is a place to be for expert info on gender. Today I would like to discuss medical transition for trans men or non-binary people more in detail. Now before we start, I'd like to point out that I'm not a medical doctor. I have a doctorate degree in clinical psychology, not in medicine. If you are on hormones or plan on starting hormones, you need to discuss your goals and options with a medical doctor. The information I'm sharing with you is intended to inform you. I'm also drawing from over a decade of personal experience in working with transgender and gender diverse people. And also make sure to subscribe to my channel, that way you don't miss any new content coming from me. Alright, let's discuss medical transition, also known as hormone transition. Keep in mind that surgical transition will be talked in detail in my future videos, but for today I really want to discuss what medical intervention is involved in hormone transition. I will also be making future videos discussing areas where you can expect changes to take place while you're on hormones. So let's begin talking about hormonal transition, also known as a medical transition. For starters, let's be clear that hormones are not for everyone. It's not mandatory to be on HRT in order to transition. But if your goal is to masculinize physically as much as you can, hormones may be an option for you. So if you plan or thinking about studying hormones, most likely your doctor will put you on a regimen. And depending on your age, your health, and your transition goals, regimen will look different for each individual. And by regimen in this case, I mean the dosage, the dose of the hormone. Generally speaking, hormone therapy for trans men or non-binary people only includes one type of medicine, and that's testosterone or T. Testosterone comes in several forms. Most often, trans men will use injectable form of T. Some choose to begin on a lower dose and slowly increase it, while others begin at a standard dose. For non-binary people who are seeking several masculinizing changes, microdosing T is an option. However, as I have written in a blog posted below, as well as when I discussed microdosing T in my prior video, also linked below, discussing what your goals are with your doctor is very important in this case, because it is less about the dose and more about how your body will metabolize testosterone. So make sure you talk to your doctor about changes and goals you expect to obtain microdosing T. In addition to injections, there are also transdermal forms of testosterone, which include patches, gels, and creams. In some people, these forms cause changes to progress at a much slower rate. And again, if you are seeking subtle masculizing changes, this may be a great option for you. Now, another route of administration that is becoming very popular are pellets, and pellets are small tiny compounds that are placed under the skin, and it allows delivery of small amount of hormone in the bloodstream. Usually a pellet can last on average about 3 to 6 months. Pellets are especially popular among people who are afraid of needles, or in general with people who tend to forget to take their testosterone dosage. The problem with pellets is that not all doctors do it, and also insurance may not be able to cover it, and it can end up being costly. Now, many people tend to believe that the higher a dose of testosterone, the sooner they will experience physical changes. But taking high doses doesn't necessarily make changes happen quicker. In fact, it can endanger your health. If your body has a high dose of testosterone, it can convert it to estrogen, which is exactly what you're trying to avoid. In addition, it can increase your risk of uterine imbalance or even cause cancer, and can make you feel anxious or agitated and cause your cholesterol or blood count to get too high. So please keep in mind that a high dose is not always best. Again, a good discussion and an ongoing monitoring of your blood work with your doctor is very important to health. Best is to find a dose that really works well for your body. And finding a doctor knowledgeable in trans medicine is also important. And if you are in California, I just can't say enough good things about Dr. Christine Vrieger or Dr. V from Metamorphosis Clinic. See a link to her page below. So there you go, and over your hormone medicine for trans guys. It's like I said, there's only one hormone. Again, keep in mind that any plans to start or modify your current regimen should always be discussed with your doctor. Stopping to take medication without consulting your doctor is dangerous. It can be deadly. So be mindful about your health. All of this is here to help you get better information, not to take matters into your own hands. If you are on testosterone, please do comment below. I'd love to hear from you and share your experience of what you found helpful. And if you are new to this channel, consider subscribing, and I look forward to seeing all of you next Friday. Bye.